Hi, I'm Chelsea, one of the pelvic physical therapists here at UCSD, here to provide some education going into your RAL procedure and hoping to optimize your outcomes with symptoms that you may experience post-op, including urinary incontinence, urgency, pain or swelling, scar management, as well as constipation and breath work. Um, you will be discharged with a catheter post-op, and so that will be something that typically is attached to the leg to let the pelvic floor muscles relax and heal and recover. And the timing on to when that's removed can vary depending on patient population, but we typically will not see you in the clinic until that's been removed. And so just understand that that's part of your healing process, and that will take time to kind of let your body adjust to that. Um, you also may experience some swelling to the pelvic floor musculature and or some pain in the pelvic region or urogenital triangle. Know that that can be normal. There are ways to mitigate that pain, such as using an ice pack or a padsicle that you can place kind of within the underwear, and you could also sit on something like a bag of peas or corn, but just make sure that you are having a barrier between the skin and the ice compression as well. You typically would only use that for 10 to 15 minutes to just help mitigate the pain. Use it sparingly kind of throughout the day. Something also that can be beneficial is to incorporate small bouts of walking approximately every 2 hours within that first week of recovery. And you can increase the time by a minute to 2 minutes each week of your recovery post-op, depending on symptoms and pain management. You need to focus post-op on your breath patterns. This is important because if we're increasing intra-abdominal pressure, such as with constipation, getting into and out of the car, into and out of bed, doing a sit to stand, that can increase pressure through the abdomen and pelvic floor, which are recovering. And so something that we can focus on is exhaling with that exertion. So when you are doing that sit to stand or getting up and out of bed, try to breathe out through your mouth like you're blowing out birthday candles or blowing up a balloon, creating a belly hard pattern with the exhale through the mouth. So trying to kind of engage the ribs and blow out with that exertion. A part that we see happen often with this that can be challenging would be with constipation management. Constipation can happen after surgery, secondary to different medications that you may have taken, and anesthesia post-op. And so maintain your bowel regimen that you're given post-op, as well as increasing fluid and fiber intake. Those gentle walks can also be helpful. However, when you're sitting on the toilet and you feel the urge to pass a bowel movement, instead of holding your breath, we want to try and do that forceful exhale where the belly contracts, pelvic floor stays relaxed, but we're doing kind of that forceful breath out through the mouth like you're blowing out birthday candles or blowing up a balloon instead of holding our breath. When we hold our breath, all of that intra-abdominal pressure goes downward and can put a lot of force through the pelvic floor, which we want to avoid. Another common symptom post-op is kind of pain at the scar site. So if you are noticing that or you're noticing increased sensitivity, follow signs of active inflammation like redness, bleeding, swelling. Those would be things, any sort of oozing or pain that you would reach out to the doctor for. However, if it just seems like the scars are sensitive or tight, know that it's okay to create some gentle scar mobility. So if the scar was here, you're trying to always push down towards the scar or up towards the scar. Gentle circles over the scar is normal, and okay and safe to do post-op. I also recommend just a gentle desensitization when you get out of the shower. So using your towel just lightly to touch over the scar can help decrease that tissue sensitivity. Typically would have you start this though closer to that 2 week to 4 week mark, pending what your doctor is okay with. But this could be something that can help with any sort of scar sensitivity that can happen as well. From a pelvic floor standpoint, we tend to see an increase in urinary incontinence with some patients post-op once you've had that catheter removed. Something that we would encourage would be to start doing pelvic floor contractions after your catheter has been removed. Typically, you will not see a pelvic floor physical therapist until the catheter has been removed as well. And with that, I want to teach how to do a Kegel or a pelvic floor contraction. So this is the male model. These are the pelvic floor muscles that we are talking about. Our favorite analogy for doing a Kegel or pelvic floor contraction would be to hold back gas or hold back urine, or like you're trying to retract the genitalia or penis length. So you're trying to contract the pelvic floor without engaging the abdominal muscles from above, the glutes on either side, or your inner thighs. We typically recommend starting with one set of 10 Kegels where you're just contracting and holding for a second, relaxing fully, contracting and relaxing 10 reps. You also can incorporate doing 2 sets of 10 longer holds or endurance contractions where you're holding for a 5-second bout and then relaxing, hold for 5 seconds, relaxing, working up to 3 sets of 10 in the day. Typically post-op, I would recommend doing this in a laying down or supine position, as well as sitting tends to be most comfortable. Lastly, it's important to incorporate these in your day-to-day. So when you are doing that exertional force from sitting to standing, getting up off the chair, out of your car, out of bed, try to do that Kegel with that breath work that we talked about earlier, where you're bracing the abdomen, squeezing the pelvic floor, and breathing out through the mouth as you exert the force. So as you're doing the motion. Getting up and out of bed in order to evolve or trying to not do a full sit-up type contraction because that increases that abdominal pressure. Roll to your side, push through your elbow, and then push through your hand as you get up. So just to reiterate, working up to 3 sets of 10 Kegels in the day, both with quick flick contractions as well as endurance holds can be helpful, and then incorporating that into different types of transfers as well throughout the day can be helpful. If you're still experiencing symptoms or leakage, this would be something to consult with your provider so that we could get you into pelvic floor PT.